The shoulder joint injury is the most common injury seen in all of the aquatic disciplines of swimming, synchronized swimming, diving, open water swimming, and water polo. This video will describe how the shoulder joint functions and then show a series of exercises to best protect the shoulder from injury and prevent time lost from training and competition. On first glance, the shoulder and its surrounding tissue appear to look simple. The two main bones of the shoulder are the humerus, which is the long bone of the upper arm. The scapula is known more simply as the shoulder blade. The bony joint cavity is known as the glenoid fossa. Ligaments connect the bones of the shoulder, and tendons join the bones to surrounding muscles. The biceps tendon attaches the biceps muscle to the shoulder and helps to stabilize the joint. Other shoulder joint stabilizers are the four short muscles that originate on the scapula and pass around the shoulder, where their tendons fuse together to form the rotator cuff. While the shoulder joint is categorized as a ball and socket joint, the socket is shallow. It resembles more a golf ball on a tee than a true ball inside of a socket. Although this puts the shoulder at a greater risk of injury, it gives the shoulder an amazing range of motion. The disadvantage is that many forces can combine to make the joint more unstable and result in joint damage or failure. It is surprising to realize that the true power source for the shoulder comes from the upper back and abdominal muscles and not from the shoulder itself. The shoulder blade transmits these forces through the shoulder to the athlete's arm for swimming, throwing, lifting, and a myriad of other activities required in all of the aquatic sports. The athlete should not wait until the shoulder is sore to begin these preventative exercises. While there are many problems that may cause shoulder injury, the most common problems include poor technique and a sudden increase in training. These following exercises address the three important anatomical areas. The muscles of the low back, abdomen, and pelvis make up what is known as the core muscles of the body. The side plank raise focuses on building the lateral sides of the core. This exercise is performed with the athlete on their side with a towel or a mat. The support arm should be directly under your shoulder, with the remainder of your body in a straight line stretched out with a good posture from the hips down. Lift the hips off the ground until the body is in a complete straight line. Remember to achieve symmetry. The other arm can be at your side or raised to a T-like position to make the exercise more difficult and is a more advanced form of the exercise. Repeat the exercise 3 to 6 times for 30 seconds. This exercise is called the quadruped. The goal of this exercise is to balance the shoulder, which is critical for all of the aquatic disciplines, whether in the air or in water. The athlete lifts an arm and the opposite leg straight out, balancing on the opposing arm and leg. The athlete will build up their capacity so they can hold the position for a count of 30 seconds. The exercise can be performed again either on the same side, which is more difficult due to fatiguing, or the opposite side as strength and endurance are being built. Each side is repeated 6 times. The exercise is more difficult using the balance ball. Be vigilant to differences from one side to the other, since all of the aquatic athletes need symmetry to excel. The next exercise is called the chair pelvic tilt and crunch. This 3-way crunch using a chair focuses on strengthening all the abdominal muscles equally. Lay on your back with your lower legs resting on a chair. From this position, you will be doing 3 crunches. Your shoulders and upper back should rise up off the ground. Your arms should be straight ahead with your hands together and index fingers touching. The 3 positions for the crunch are middle, left, and right. Each position should be held for 2 seconds. In the first and middle position, crunch up so that your arms reach between your knees. As a guideline, your hand may pass 3 to 6 inches beyond your knees. It is important to be symmetrical in the amount of rotation to the left and to the right, and always maintain the pelvic tilt and core positioning with your back flat on the floor. Do not use your hips, legs, or any other muscles to push your back down. The scapula is a gliding joint. The muscles around the scapula link the core to the shoulder. The next exercise is called the hitchhiker. The hitchhiker allows you to strengthen the muscles of the scapula as well as discover imbalances between the left and right sides. The athlete lies face down on a flat surface. It is recommended that unless this is a cushioned surface, that a towel or mat be used to protect the athlete. The arms are raised directly off of the flat surface and up while squeezing the scapula together. The thumbs stay pointing upward. The athlete works up to 20 repetitions per set and 3 to 6 sets. The scapula push-ups focus on building the power through the scapula and teaching the scapula to fire early in the power sequence. The athlete gets into a push-up position with elbows slightly bent, balancing on hands and feet or hands and knees, which is an easier format. The athlete begins the exercise by bringing their scapula toward each other. The upper back has a squeezing motion. The arms do not have to bend to lower the chest toward the ground. The recommended number of scapular push-ups is to work up to 20 to 30, with 3 to 6 sets being performed. The isolated shrug works on building the strength of the scapular muscles as well as reinforcing the early firing of the scapula when the shoulder is being asked to create force. The athlete positions one knee on a bench, the opposite arm is used for support and is under the head. The athlete grasps the weight with a slightly bent arm. The scapula glides over the ribs to lift the weight. Once the weight is lifted by the scapula glide, it is slowly lowered and the exercise is repeated. The athlete will build up to 20 repetitions and 3 to 6 sets with attention to correct form throughout the exercise. The last exercise in this group of scapular exercises is called the swimmer, which works on balance and scapular symmetry. Begin seated on a Swiss ball or chair with most of your body weight on the balls of your feet. Lean forward with a flat back, abdominal muscles held tight, and scapula or upper back squeezed down and in. The chin and head are held down and inward towards the neck. The arms are extended in front of you with palms down, holding a light ball or weight. While maintaining a forward lean with straight arms extended in front of you, bring the arms behind your body and back with palms up. Try to maintain the pelvis in a position so one can feel the abdominal muscles working throughout the exercise. One repetition should only take 5 to 6 seconds. Doing the exercise 10 to 20 times is fine. Since the swimmer is a double exercise, a lower number of repetitions is necessary, with a total of 3 to 6 sets. A Swiss ball makes the exercise more difficult, but the use of a chair is fine. Last, we will discuss 4 exercises that work the rotator cuff. The first exercise is called the ball on the wall. This simple exercise quickly fires the rotator cuff muscles, allowing for balance in centering the humerus in the joint. While the athlete is standing with their side to the wall at 90 degrees, they hold a small ball against the wall with their elbows straight. The ball is rolled in all directions. The athlete can perform 3 to 6 sets, and each set is 30 seconds long. One shoulder may be stronger than the other. It is important that over time the athlete ensures that both shoulders become equally strong at this exercise. This may require extra sets on the weaker side until it comes up to equal the stronger side. The next exercise is called Shake It Up. The athlete holds the water bottle parallel to the floor and up with the elbow bent to 90 degrees. The bottle is then shaken for 30 seconds with a goal of 6 to 10 times on each side. Once again, the athlete needs to be aware that equal strength on both sides is extremely important over time. This quick alternating motion works to challenge the rotator cuff muscles to fire quickly as they do in swimming. It is also a solid exercise for the throwing motion, handstands, and lifts. The heavier the water bottle, the more difficult the exercise will be. The next exercise is internal and external rotation, which emphasizes several aspects of rotator cuff functions as well as improving the strength within the rotator cuff muscles. Plastic tubing, bungee cords, or a weight machine can be used. The athlete stands to the side of the tube or weight machine at 90 degrees with their hand in the C grip and the elbow locked at the waist. The shoulder and hand move in toward the abdominals for internal rotation. Now turn the body facing the other direction and work external rotation. The athlete can work up to 20 repetitions of each exercise with 3 to 6 sets. Strength needs to be equal internally and externally, as well as on the right and left side of the body. The last exercise is called the drop and catch. Rapid firing and coordination of the rotator cuff is very important. This exercise works to improve both. A small weight, roll of tape, or a small ball can be used for this exercise. Bring the arm forward and parallel to the ground. Now drop the object about 6 inches and then catch it in the 15-degree range toward the body. It is always important to maintain good posture and stand tall. The athlete should feel the back of the shoulder being worked after 20 repetitions. When considering this preventative exercise program, 4 important principles should be taken into account. The performance of accurate and correct technique of the exercises shown in this video is critical. The exercises should be integrated into the regular training routine. Start simple with a few exercises for the younger athlete and build the program as the athlete matures. Do not wait until the shoulder is sore to initiate prevention. Implementation of this shoulder prevention program will not only prevent shoulder injuries, it will also improve your performance in the water and prevent time lost from injury.